Good morning, everyone. Good morning, everyone. My name is CJ Nagama. So, this is the description of Bacillus anthracis. The shape or form of it is rod shaped, and it's chained together in boxcar-like chains. It's about 1 micrometer by 4 micrometers. So they're all chained together in little, lines. So they're longer than they are wide. The other properties or descriptors of Bacillus anthracis are that they're gram-positive, they're non-motile, so they don't move around, and they have the ability to create spores whenever their environment gets rough for them. What is Bacillus anthracis? So, Bacillus anthracis is the bacteria that causes anthrax. It normally affects livestock and is found in natural soil. It is a highly durable disease that is found in many different areas around the world, and it is hard to kill, as Bacillus anthracis has the ability to form spores. The only place that these spores are not found is Antarctica. The most common symptoms of the disease caused by Bacillus anthracis, anthrax, are skin sores, vomiting, and shock. So this disease, or this bacteria, normally affects any wildlife like deer or livestock. So anytime that you are dealing with livestock or any wild animal, you should be careful, especially if you are in an area that anthrax spores is found. How does it affect the body? Anthrax spores spread throughout the body through the first point of entrance. The anthrax, if treated quickly, is not normally a deadly disease, but if left for a while, anthrax starts to release toxins into the body. These toxins would begin to disable the immune system and prevent a response that would fight back against the infection. Without these toxins present, the body would normally be able to fight off an anthrax infection by itself. So there are 3 ways for the anthrax spores to enter the body. These are through the mouth, or through the lungs, through the air, through a cut in the skin, or through the ingestion of it. So if you breathe in the spores, this causes anthrax, inhalation anthrax. This is the deadliest form of anthrax with a mortality rate of 45%, even with aggressive treatment. Has flu-like symptoms, is caused by breathing in the spores, and may take up to 6 weeks to form. So this means that even if you are exposed to spores, you might not know it or might not face symptoms of it until after 6 weeks. If you get a cut and then are exposed through that cut to anthrax spores, this causes cutaneous anthrax. This is caused by coming into contact with spores via any open wound. It's the most common form of anthrax, has very faint symptoms, and it normally causes a raised bump like a bad bug bite. So these ones are anytime you are working out just in an area that has anthrax spores and you get a cut on your arm or anything like that, and then get exposed to any spores, that cutaneous anthrax will happen. The last one, if you eat any anthrax spores, is caused by ingestion anthrax. This is caused by the ingestion of spores can affect the entire digestive tract, has bad stomach ache-like symptoms. So this specific type of anthrax can affect you all the way from your mouth where you ate it all the way up to your anus so just the entire digestive tract as a whole. So these are the medical treatments for anthrax. Most would treat anthrax through the use of antibiotics. However, the forms of anthrax differ in how the anthrax is treated depending on which strain you are dealing with. Most treatments combat the symptoms and attempt to prevent them from developing rather than fighting off the actual anthrax. This is because the symptoms are normally the worst part of it. Your body is able to fight off anthrax if it has the capability. So most of the medication fights off just the symptoms to alleviate them so your body can do the rest. So these are the specific medical responses for the different strains. For inhalation anthrax, it's penicillin with clindamycin or clarithromycin. For cutaneous anthrax, it's doxycycline or ciprofloxacin. It's used for the first line of treatment. And for ingestion anthrax, it's penicillin with streptomycin. Other treatments. There have been some other new treatments developed to treat anthrax other than the traditional method. These two are the antitoxins. They deal with getting rid of the toxins that the anthrax creates rather than fighting off the actual anthrax or the symptoms itself. It's because as your body is, it is able to fight off anthrax if it isn't suppressed. But the anthrax releases toxins that will suppress the immune system, not letting it fight back. But with these two medications, it is able to fight back against anthrax because the toxins are gotten rid of because of these two. And so these are severe cases of anthrax. Severe cases of anthrax only occur when the infection has created enough toxins that medication is unable to kill it off in a timely manner. Intensive care is required for those being affected by this level of infection. Ventilators, vasopressors, and fluids are all usually required to give the patients a chance to recover. The patient must be given time to recover, and their body must fight off the infection on its own. This is after there's too much toxins. You're just left to fight it off on your own with the support of machines. There's no medication that could really help. There could be medication to alleviate the symptoms, but nothing to actually get rid of the anthrax. So these are some statistics. With a penicillin combination, the statistics depend on the type of anthrax being dealt with. With cutaneous anthrax, survival rate is almost 100%. Digestive anthrax survival rate is about 60%, and inhalation anthrax, the survival rate is about 55%. These three statistics are mainly within quick treatment. So if you have aggressive treatment and you catch on quick that you have anthrax and immediately get medical help. With supportive care, the statistics also differ depending on anthrax classifications. Cutaneous anthrax has a survival rate of almost 100%. Digestive anthrax, almost 72%. And then inhalation anthrax has that percent. So, some fun facts. In 2001, the anthrax spores were used in a terrorist attack. It was after September 11th, as they were mailed to different houses and caused about 22 infections and 5 deaths. You cannot get infected by anthrax via other people, only the spores. Bacillus anthracis has multiple traits of what the CDC would refer to as a bioweapon, so the CDC does refer to anthrax as a possible bioweapon. And both the United States and the Soviet Union had put in research to see what they could do with it. There is a vaccine for anthrax. It requires 6 shots for protection and is followed by a yearly booster, and this is mostly used by the military. And vaccination of anthrax is not only recommended to the general public because supplies are limited, and it's not really confirmed on where or when a anthrax infection may